Have you ever wondered how a medical condition can just kind of appear out of nowhere and suddenly become a household name? Well, today we're going to unpack the incredible story of panic disorder and Xanax. It's this wild tale of medicine, marketing, and a truly mind-boggling increase in diagnoses.
So let's just jump right in with a pretty wild question. How does a medical diagnosis grow by over 1,000 times in just a few decades? I mean, that sounds impossible, right? But that's exactly what happened with panic disorder.
Yeah, you heard that right. A 1,000-fold increase. Just let that sink in for a second. This wasn't some slow, organic change in how we understood things. No, this was an absolute explosion. And to figure out how in the world that happened, we've got to go back in time a bit.
All right, so let's get into this mystery. To really get a handle on where this explosive growth came from, we need to understand what the world of anxiety even looked like before this all kicked off. So picture it. It's before the 1980s. You have this sudden, totally overwhelming wave of fear. It feels exactly like a heart attack. What would a doctor call that? Well, the answer was messy. And for the person going through it, it was usually super unsatisfying. I mean, really try to imagine this. Your heart is hammering in your chest, you're gasping for air, you are 100% convinced you're dying. So you rush to the ER, they run all the tests, and they find absolutely nothing wrong with you physically. For so many people in the 1970s, this utterly terrifying experience didn't even have a proper name. And you can just imagine the huge disconnect this created, right? On one side, you have someone experiencing pure, unfiltered terror, a feeling that is as real as a broken bone. But on the other side, you've got a doctor who, with no clear diagnosis to go on, might just shrug and say, "Oh, it's just your nerves," or even worse, imply that it's all in your head.
The official term back then was anxiety neurosis. It was this super vague, catch-all label in the big book of psychiatric diagnoses, the DSM-2. It basically lumped everything together, so it wasn't really useful. And this lack of clarity, it created a huge void in the medical world. And as we know, when there's a void, someone or something is always ready to fill it. And that's where our story takes a turn. Because where the medical world saw confusion and a puzzle they couldn't solve, a pharmaceutical company called Upjohn saw something else entirely. A golden opportunity for its brand new drug, Xanax.
Okay, so let's lay out the key players here. First, you've got the company, Upjohn, and they've got this new drug, Xanax. Their big goal? To knock the reigning champ of anxiety meds, diazepam, off its throne. And their collaborator in this whole thing? A researcher named Dr. David Sheehan, who was totally fascinated by these intense, mysterious panic episodes.
Now, check out this quote from Dr. Sheehan himself. It's pretty eye-opening. The company's strategy was to take advantage of the medical profession's confusion in classifying anxiety disorders. Whoa. So this wasn't just about, hey, we have a pill that can help with this problem. No, this was about actively shaping and defining the problem to fit their solution.
And this gets us to the absolute heart of the strategy, a concept you could call condition branding. And let me be clear, this was no happy accident. This was a calculated, step-by-step plan to literally build a brand new market from scratch. So what in the world is condition branding? Well, simply put, it's when a drug company actively helps to establish, define, and promote a specific medical condition, all to create the perfect custom-built market for its drug. So how did they actually pull this off? It was a genius 4-step playbook. Step 1, you fund the research to nail down the exact symptoms. Step 2, you sponsor a big conference to get all the top doctors to agree on those symptoms. Step 3, you use that agreement to help create an official new diagnosis, panic disorder. And then the final move, the checkmate, you get the exclusive FDA approval for your drug, Xanax, to treat that brand new disorder. And this timeline here just lays it all out so clearly. You can see the groundwork being laid all through the 70s, then bam, 1980, panic disorder officially becomes a thing. And what happens right after that? Well, right on cue, Xanax gets the FDA's stamp of approval. The timing, you have to admit, was perfect. All right, so now we get to the big payoff. What was the end result of this perfectly executed plan of basically creating a diagnosis and then tying it to one specific pill? The result? In a word, total domination. Now, you're probably thinking, okay, so Xanax must have been some kind of miracle cure, right? Way better than anything else? Well, the simple answer is nope, not really.
The truth is, the whole class of drugs it belonged to, the benzodiazepines, they were all pretty good at treating panic. There was nothing that made Xanax clinically special.
See, the secret sauce wasn't the pill itself, it was the label. Getting that exclusive FDA approval, being the first and only drug officially approved for panic disorder, that was the golden ticket. It meant Upjohn could walk into any doctor's office and say, look, here's the official problem, and guess what? We have the one and only official solution.
And the result was a complete and total market takeover. You look at the before, a fuzzy diagnosis and lots of different drugs competing. Then you look at the after, a laser-focused diagnosis, and one undisputed king of the market, Xanax. It's a textbook example of how you can reshape an entire medical landscape.
And of course, the marketing push that followed was massive. They published their research in all the right journals to give it that scientific credibility. They paid for doctors to go on speaking tours. And here's the real stroke of genius. They went after cardiologists. Why? Because cardiologists were the first doctors to see these terrified patients who thought they were having a heart attack. They taught them all about this heart-brain connection and basically gave them a way to finally diagnose and treat these people they previously had no answers for.
So, when you step back and look at all the pieces, what's the real legacy of this whole story? We've seen the playbook, right? Define the problem, position your pill as the solution, and basically create the market from thin air. What it boils down to is this. A brilliant strategy took a very real, very terrifying, but totally misunderstood human experience, gave it a name, gave it a neat little diagnostic code, and then chained it directly to a single patented pill. That connection right there was the engine that powered that thousand-fold growth we talked about at the very beginning.
And all of this leaves us with a really deep question, one that goes way beyond just Xanax. Look, by giving a name to this hidden suffering, there's no doubt that this whole process helped a lot of people finally get a diagnosis and treatment. But it also forces us to ask a tough question. Where is the line? When does defining a disease to help people cross over into marketing a disease to sell a product? It's a tricky one, and it's definitely something worth thinking about.